So the idea of these sessions was just really to share a little bit of information about the new Northwest Midwifery and Nursing Midwifery and Allied Health Professionals Capability and Capacity Strategy 21 to 24. That's quite a mouthful. And just to sort of give you an overview and an opportunity to ask questions. So I hope you've all had chance to cast your eye over it and have a read, but if not, don't worry. Hopefully after this you'll have a general understanding and then you can go away and have a look at it in more detail. I will just hang on a couple of seconds because more people are arriving. It's only 2 minutes past 12. Sorry for being starting Bob on 12. So I was just saying to everybody, it's a small group. If you want to put your camera on, you can do, but keep your microphone switched off. Because it's Teams, once I click onto the presentation, I'll be talking to my slides anyway. Do feel free to put questions in the chat box and Leanne will be monitoring that. But also we will have time at the end for people to actually ask the questions and respond to them verbally. We are recording the session, so that is for anybody else who can't be here today. We will upload that to our website and hopefully people will get a chance to view it retrospectively. Okay, I think it's 3 minutes past 12. I'm just wondering, should I wait till 5 past to start the presentation? What do people think? Oh, hello to Sam from Doncaster and Bassetlaw. From over the Pennines there, welcome. Are you a colleague of Julie Berry's?
Yes, I am. So we've supported her doing her fellowship, which is exciting. She shared the link with me actually. So yeah.
Okay, well, welcome. And we've got Alison McCracken, Alison Cook, Angie Kelsall, and I think we've got Ruth as well from the ECRDP. Right. Couple more minutes and then we will start.
Nobody had to register, so we just don't know who's coming.
No, Ian Jones, no. It's just an open invitation. I said I will crack on. Welcome in. We're saying keep your camera on if you want to, but perhaps switch your microphone off. We're starting the presentation in 60 seconds. We're just letting people, sort of few people come on board. Opportunity to ask questions at the end, but do feel free to put questions in the chat. And the idea of the session is just to give people an overview of the strategy that we've written for the Northwest. But hopefully you've had a chance to look at the full document. So for those of you that don't know me, my name is Gillian Southgate and I am the Director of Collaborations for NHS Research and Development Northwest. Been working in R&D for about 10 years and by background I am an AHP, I'm an occupational therapist. And I'd just like to introduce my colleague Mary Speak. So Mary is Joint Workforce Lead for both of the clinical research networks and has been involved in shaping the strategy. So she will be coming from that research delivery perspective. And my colleague Leanne Gregory, who's in the background making sure all the tech works. So yeah, don't look to me if it all goes a bit booloo. I've not got a clue. So I'm going to share my slides now. So hopefully, Leanne, is that shared okay?
Yeah, that's fine. I can see them.
Okay, so welcome everybody. So an overview of the Northwest England Nursing Midwifery and Allied Health Professionals Research Capacity and Capability Strategy 2021 to 2024. So what is this strategy? So we've put this together to be a sort of regional plan for providers, so that's employers, for practitioners across the Northwest. And it's about developing research capability and capacity for people who are non-medical. Now, we've used the title Nursing Midwifery and Allied Health Professionals in the NHS and social care. And we have taken on board the fact that there are wider professions that may feel they're not included in this because they're not mentioned in the title. So if you look on page 6, we talk about the inclusive nature of this, and basically it is anybody. And we do apologise particularly to social workers and to psychologists and to healthcare scientists who feel they've been excluded. That isn't our intention, and it is inclusive. So it's we're focusing very much on those 29 ICA eligible professions. So it's been commissioned by Health Education England Northwest. So they've asked us, NHS R&D Northwest, to develop and write this strategy in consultation with themselves, the HE strategic directors, with service leads, and of course our colleagues from the clinical research networks in the Northwest Coast and the Greater Manchester. And we have consulted with a whole range of representatives from social care, clinical academics, and consultants from across the region, as well as patient representatives. A draft strategy was shared for review prior to publication, and we did have a meeting on Teams. However, that did take place in the midst of a pandemic, and it has been acknowledged that perhaps not everybody who wanted to be there could have been there. And I think it's important to say that, you know, this is not a fixed, unmovable, written in stone document, that as we move forwards, that probably in 12 months' time, that we are completely happy to make amendments as and when needed. So why do we need one? Well, you're probably aware there's a lot of strategies coming out at the moment. The underpinning driver for this is about research active organisations having better patient outcomes. And originally, you will have probably known about the NMAHP publication around colorectal surgery, and that research active organisations had better mortality rates. But we know since from further surveys and papers that this is true. Research active organisations are just better all round. Nurse, midwives and allied health professionals' clinical academic careers need developing. Yeah, there's been great strides since 2004, since 2006 and the creation of the NHR, but there's still further work to be done. I think it's very, very timely. COVID has been horrendous, but what it has done has highlighted the importance of research in health and social care, but not also the importance of it, but how we can be much more agile and respond much more quickly, and, you know, really improve that bench to bedside time frame, which historically has been as long as 16 years. You know, we can rapidly do research and make an impact on patient care. A culture of research supports recruitment and retention. I'm sure you're not, you know that we are apparently in the NHS losing staff right, left and centre. Organisations are desperate to find ways to retain the staff, to recruit really good staff. Well, a culture of research is one way to do that. Other regions and other organisations are developing their own strategies, you know, so we originally took our lead from the work that had been done in the Northeast, and I know other regions are taking the lead from us. I am aware that the HE are developing one for nurses and HPs separately, nationally, so there's going to be a lot out there. And I think for the Northwest region, this particular strategy is about having a joined up with region wide approach. We do acknowledge that we've got different levels of research activity in the region. We've got different levels of support for NMAHPs, but it would be nice if we can sort of pull all that together and have a little bit more of a coherent approach. So this was taken from some work that was done for HE by the University of Southampton 2 or 3 years ago, and this slide just epitomises the barriers enablers to NMAHP research careers, and I'm sure many of you are already familiar with this. So the barriers are lack of research career pathways, lack of available positions within NHS trusts and care organisations, lack of availability of funding, difficulty maintaining research activity alongside a clinical role, and inadequate support from employing organisations. So we do have lots of people, you know, we've got lots of postdoctorate health professionals out there in band 6 roles, getting the waiting list down. And we know that the enablers are about funding, awarding funding, about fellowships, about giving people the necessary skills, creating that career pathway, giving them the advice, support and guidance, providing coaching and mentoring, and making sure that they've got a very visible role, not just within their organisations, but wider than that, across the region within professional bodies, and making sure that we're working much more closely with our academic partners in university. And at the bottom there it says, you know, we want more, a larger number of clinical academic training positions, particularly in the North West Coast region. Over recent years, the numbers have lagged behind for NIHR ICA fellowships in comparison to other regions. So we've got 5 strategic overarching aims. Because we're encompassing a big area, and like I said, we've got quite huge disparity across the region around research engagement, we do recognise that these aims are broad and they are wide. But the first and foremost is about creating a vibrant and growing NMAHP research culture that is underpinned by core commitment from employers who recognise the value of a research active workforce. So when we talk about research culture, that is not about everybody's doing research. In a good research culture, you've got the whole organisation is supporting research. You've got quite a large number of people doing research, and we want more nurses and HPs to be doing and leading as research delivery staff. And then you've got a small number that are actually leading. Cultures are hard to change and they're hard to create, but the key thing here is about raising awareness, about research champions, about raising research awareness and promoting a culture of inquiry and critical thinking. Our second aim is all about providing clarity and support for regional research career development pathways, training and fellowships for NMAHP research careers. So we're acknowledging that, you know, to build your research skills and confidence, there needs to be leadership in place to provide that infrastructure. You know, there's very, very few clinical academic roles in the region. There's very few in comparison to the numbers of people working in the healthcare system, and we need more of those. And we need them as well at lots of different levels, but we need to understand how to get there. It's very, very foggy, and I think people find it difficult to know how to navigate the system, never mind how to create their own career pathway. So we need to be providing clarity and support for that. And when we talk about research talent, we need to maximise research talent and potential across NMAHP, so that we retain and recruit people. So this is something about recognising people very early on in their careers, that often people are reaching their potentials in their 50s, 40s, 50s, towards the end of their career. Not that I want to be ageist, because that is brilliant. But imagine if we're catching people out of university, those people who've got a passion for research, they've got a first, you know, and we are investing in them, and we'll get 30 or 40 years out of them doing brilliant world-class research. So really it's about spotting that talent and supporting that talent to develop sooner. So this is about our research specific, all of it is inclusive of research delivery, but this is very specifically about those professionals who wish to attain research competency through a clinical research delivery route and leading as well as delivering research led by others. So that's working closely with the clinical research networks and the career opportunities they provide and the training, and recognising that, you know, PIs and CIs can be nurses and allied health professions, not just medics, and giving them support to do that. But also within that, we recognise that those people who are research delivery professionals may also want to develop their own clinical academic career and eventually lead and deliver their own research. And this is about providing equitable access and opportunities to research career development for healthcare professionals from both health and social care practice. So as we move into the new health landscape, as we look at our integrated care systems, we are, you know, we need to make sure that we're inclusive of social care. Social care has probably had less opportunity around research, particularly for nurse midwives and AHPs. We are developing opportunities for for them. There are now new ICA fellowships. So it's making sure that we include the wider workforce around health and social care, and it's not just focused on the NHS. So those are the aims. And if you look in the actual long version of the strategy, underneath that there's quite a lot more information to give you a sense of what's being done or what can be done. What we have to acknowledge is that the region's health and social care system is devolved. It's a devolved matter. You know, none of the collaboration with this strategy, we have no mandate to enforce any of this. So we're hoping that people will see the value of it and that we'll win hearts and minds and make changes. Each individual administration has the flexibility to deliver the strategy in the way that is most effective for them and their population. And that is the point of a strategy. If it's too prescriptive, then you can't have one size that fits all. So it is broad and hopefully gives enough information for all of those variables and differences. However, that said, all 4 partners, both CRNs, HEE, ourselves, we're committed to working together collaboratively. We see the value of working together and of bringing a cohesive approach to the region. And wherever possible, we will pool our collective efforts to take a Northwest-wide approach. Included in the actual strategy then is a roadmap to show you how it could be delivered. Like I said, that's not a mandate. It's not how you have to do it. We've got something called an implementation plan, and we are going to be pulling together an implementation group. We've just done the terms of reference, and we will be inviting people personally. We want initially for those people around the table to be system leaders, to be influencers, to be at board level, so that they can actually influence change. And we want to ensure that we've got change across the spectrum of activity. So it's anticipated, I can't see the last bit of my slide there. Anyway, it's anticipated that organisations, individuals will take some responsibility and accountability for delivering these opportunities, and also, as we said, mitigating barriers, so that the implementation group of system leaders will really embrace this and take this on board. And the first meeting of the implementation group will take place in September, and hopefully we'll be able to report on that in another information session at a later date. And obviously, they will have their own ideas about how to take this forwards, and it may be that we pull some amendments into the strategy to show people what, some exemplars of what's already been done, and also some ideas of what other people are taking forwards. So I've just talked about the implementation group. Again, it's about collaboration, and it's about, there's something very popular called twinning. So about twinning organisations. I know that's already going on in some instances. I know there's some mentoring going on between Preston and MFT. There's some mentor in Liverpool. I know leaders are coming together and supporting each other, but we want more of that. And we want to be able to monitor the response to and the progress of the strategy, and give extra support to those areas that need it. So just to give you some ideas of some of the work that is going on, this is very much around training. You may already be aware of it. We've got the HEE and IHR pre-masters internship programme. Now, the one for the North is currently being led by Sheffield Hallam, but from 2022, the Northwest part will then be delivered by NHS R&D Northwest. The Applied Research Collaborations for Greater Manchester and Northwest Coast are both offering pre-masters internships, and I believe, I don't know whether it's the Northwest Coast one or the Greater Manchester one, is just advertised for this year. We've got regional pre and postdoc bridging fellowships. So that's run by NHS R&D Northwest. That is a fellowship which buys out people's time to allow them to develop excellent applications for either the doctoral ICO fellowship or the postdoc lectureships. And then, of course, we've got a whole range of national NHR ICO fellowships, which ourselves and our partners are happy to support people with their applications. We've also got running through the North West Coast Clinical Research Network a scholars programme that was originally designed for mid-career medics, but has now opened out to nurse midwives and AHPs, and that really is about people starting their research career and getting involved and understanding how to run trials, and then and apply for grants. And then they also run a regional, and this is not just the North West Coast now, this is North West Coast and Greater Manchester Early Career Research and Development Pathway. And that is for people who are thinking about it or maybe have dipped their toe in. So that's for people who are probably band 6 and 7 and MAPS AHPs who are wanting to develop a research career but need the support to develop their own research career pathway. This is not a comprehensive list, but it's just to give you a flavour of what's out there. We are developing similar things for social care. Eventually, hopefully, we can put them all together, but we have to recognise that there are different needs at the moment for different groups. So that's a very rapid overview. I'm happy now to take questions. So I'm going to come out of my slides. And I'm going to stop sharing. I can't find the stop sharing button, Leanne. There we go. Just the bottom. So have we got any questions in the chat first and foremost? Let's have a look. No. So if you want to raise your hands, that's probably the easiest way, because we've now got 1, 2, 3, 4, 5, about 10 people. So who have we got in the room? Ian. Welcome, Ian.
Hi, thank you. That was really helpful, and I welcome anything that raises the profile of nursing, midwifery, and allied health research. And also, I was relieved to hear you saying that you're aware of all the other strategies, because that's my main concern, is when you've got Cheshire and Merseyside developing their own research strategy, that they can end up competing, and we need an oversight of all the strategies. Right at the outset, you mentioned academia, and this probably won't come as a surprise to you given my day job. And also then when you mentioned the 4 partners, so given the fact that the vast majority of nursing, midwifery and allied health research is actually undertaken in higher education, how have you involved higher education in the development of the strategy or the implementation of the strategy?
So I'm actually going to be talking to the Dean's Group at HEE, and we had a number of people come from HEIs to consult. There's a move towards developing something. I'm sure you've heard of scholarship of practice. However, I'm sure you're also well aware of all the challenges between the sort of bureaucratic challenges around employment between HEIs and the NHS. So we are working on that. I don't know if you're aware of my colleague Heather Al Smith, who's got a joint professorial. And so we are looking, and we've been talking to the University of Liverpool about how we can overcome some of those barriers, because until we've addressed some of those barriers, it's really difficult to join posts and to get people that have got truly got one foot in both environments. So yeah, we're having that ongoing discussion. However, all of the programs that we're doing, so the ECRDP, for example, is accredited by the University of Liverpool. So everything we do now, we're trying to bring the 2 groups closer together. So rather than having, one group of people doing research and the other people doing clinical work and the 2 never meet, we're trying to sort of interweave it. But we do have some challenges around sort of joint posts, which I'm sure will get addressed eventually, because they managed to sort them out in medicine. So I'm sure they can do them for nurses and AHPs.
Yeah, I think I'd agree. Also, I spoke to Health Education England recently about their advanced practice faculty that's newly developed, and the concern that research isn't mentioned in any of their mission.
Thank you, Ian.
So it's interesting. We're trying to bring all these things together for ultimately to improve the research activity, which, as you rightly say, will ultimately improve patient care. And I would say just try and involve as many. It's difficult because if you involve too many people, you never go anywhere because you all end up arguing. But I'd certainly involve some of those universities that have higher student numbers, and also there are more research active in nursing and certainly in midwifery.
Yeah, thanks. And the advanced clinical practitioners roles, and I have spoken to HE about that, certainly HE Northwest, and there is, and I have pointed out that we need more emphasis on research. And I know regionally, I've had quite a few of those people new in post contact me because it's got it in their job description, and they're a bit like, oh, so yeah, there's a lot, we're all moving in the right direction, but I think there's a lot to be looking at. But thank you, thanks, Ian. We got any more questions? Angela.
Hi, Gillian.
Hi.
Thanks for the talk. So I'm coming at it from two different angles here. So I am historically a healthcare scientist. Yes. So my first question was, are they included? Because I did see them in the graphic, but again, because of the ingrained years of it being excluded, it was nice to hear that they are included. I think there is a lot more needs to be done to promote that.
Yes.
And I think a lot of people look at the title and don't even go any further, never mind get to page 3 or whatever it was on. So thanks for clarifying that. I'll be taking that back, definitely. But I also work in the clinical research facilities at MFT.
Yes.
And we're just about to do our rebid, as I'm sure you're well aware. And part of the new NIHR strategy, as you will know, is about developing these careers.
Yeah.
And I just wondered if you'd had any input from the CRFs or from the BRC as to how they could support this as well going forwards.
No, I was meeting with the BRC regularly before COVID, but we haven't had any contact since. And there was a number of email exchanges, but that they didn't go anywhere. But it's a really good point. Okay. Mary, if you want to comment on that.
Because I know in the CRF they're discussing how we can potentially support our own nurses and allied health professionals within the CRFs, but also I think there's potentially an opportunity to share some of the information. As you know, NIHR all works together. So yeah, I don't know if you want to take something offline or I can give you some names of who's leading our training strategy or whatever.
We can have a further conversation about that, but also it means that there's that the CRF need to come to the table in the implementation group.
That's
And Angela, could I check? Do they come together as a Northwest group?
Not at the moment, but there is some discussion that we're going to try and join the CRFs up in this rebid somehow. So Helen Pitt is leading that, Mary. I'm sure you know Helen very well. She's leading that potential to join. I think it's Lancs and the Liverpool CRFs and Manchester.
Okay.
But it is something, as I say, that's high on our strategic aims as well. So it looks like it could work together, or at least we could use some of your resources to train some of our staff, etc.
Absolutely, yeah. So we need to probably have a conversation there. I'll leave that to Leanne to perhaps arrange some time with myself and Mary. Super. Any other questions? I'm just going down the list. Is there any more hands up? Any more questions in the chat? Oh, Sam.
So it's not a question, but just to say thank you for letting me see all the work you've done and to share it across. I mean, obviously in Yorkshire and the Humber, and the same challenges are here as everywhere, but it's really helpful to get some momentum and consistency of view on this. I think, Ian, your point's really well made. I think we've got some staff in our workforce that have research embedded in what they should be doing. We don't make the most of that, and it's not articulated in job plans. We seem to do it really well in other professional groups. So, and I would echo your point, Angela, we've got CPD money available now, excludes healthcare scientists unhelpfully, but that is quite a nice opportunity to upskill staff into this as a career. Obviously, because we were limited from doing research dissertations, for example, and research modules with what was the old model of funding. So there's some really nice opportunities. And I notice you referenced the national strategy, so that'll be really helpful as well. I certainly will pick this up with Laura Seven, who's our senior HE lead nurse. She's obviously got a background in research activity. So I just think it's really to be commended, and great work, and really helpful to have it articulated in this way. So thank you.
No, thanks for coming along, Sam. I mean, obviously with HE, because they keep reconfigurating, we have at one point we're working across the north. But I think as well, you know, obviously, you know, we've got a big patch in the northwest, but we've got to recognise that we've got similar health inequalities and similar health issues across the northern region. Not to, you know, let's not talk about mental health, but you know, it's, and I think, you know, it's helpful as well to work across the north sometimes, not just across the northwest. So yeah, any support we can offer, you know, don't hesitate to ask. Ian, is your hand back up, or did it never go back down?
Yeah, no, it's just gone back up. Sorry, I've just put something in the chat about a piece of work that we've done in the European Society of Cardiology. We've provided a mentoring network, and the reason for this is twofold, really. One, it provides support and that sort of hand-holding, for want of a better word, but it also provides people with access to that mentor's network. And that can't be underestimated. Maria Grant, who's one of my PhD students, is doing a study at the moment on how academics write. And one of the things she's found as part of a social network analysis is that people start off very often working in their own institution. They publish with people around them. The most prolific, so she's done a looking at the 4 quartiles of academia and people who are doing research. And one of the things she's found is those people who are at the very high end doing the highest quality research are part of multiple international networks. And one of the things we have to do is to get our heads up out of our own organizations and start to think about how we can work with those networks. And mentoring is key to that, because mentors will introduce you. So as an example, Philip Moons, who is the real guru in congenital heart disease in the world in nursing, I've introduced Philip to some of my colleagues in Liverpool who work in congenital heart disease. Now Philip will then bring those on board and onto theirs, but I've become the conduit for that, to allow those people to engage and to encourage them to engage. So it isn't just about the one-to-one, it's about the networks that you can bring. And I think that having that system in place, that infrastructure in place, would be really key. And because the vast majority of people that go for NIHR funding are actually allied health professionals. Nurses and midwives tend not to, despite having the same program of activity around ACPs, etc. So it's how do we encourage those people to go for higher funding? How do we encourage those people to engage in these networks? Because it's confidence is one of the biggest issues, and mentoring will be key to that.
Yeah, thanks, Ian. Does that ring a bell with you, Ruth? Sorry, I'm looking here on my screen. We've just started our early career research and development pathway. And Ian, thank you. You were just perfect there. Mentoring has had such, you know,
Yes.
networking, you know.
I was smiling. I thought that's the message we got, and we've all started like at weekend, try to do our professional Twitter profile and start networking by tagging in, and it's already worked. We've had the invitation of like our research RD department and retweets. So I think it's what's been stressed, how important it is, and we've got mentoring is part of the course as well. So we have to find our mentors. So I think it is exactly what Gillian tried to stress that week. Yeah, thank you.
Thank you. So thanks for that, Ian. It was brilliant, very timely as well. Have we got any more questions? Like I said, you know, if you want to have a one-on-one with me or Mary and you want to go into something in more detail, just to pick up that point as well about nursing and midwifery and about Angela's comments about healthcare scientists. The title was really difficult, but there was a comment that if we didn't put nursing and midwifery in there, they wouldn't engage with it. So it's really, if we'd have put healthcare professionals or the non-medical, it's just really difficult to find the right words, you know, and not exclude people. But you're right, we really have got a push. And of course, we've got Heather Alsmith working on the NIHR nursing incubator, but really pushing for more nurses and midwives, especially in research. Okay. So thank you so much, everybody, for coming along today. It's been a real pleasure to chat to you all. And as I've said, the actual full version, medium version and short version, if you've only got 10 minutes over coffee, are all available on the website. And, you know, I'm happy to have any individual conversations and network with as many people as I can. Take care, everybody. Thank you.
Thank you.
We've got some people still here, haven't we? I don't know whether they've left the desk.
We've got, yeah, just Diane
and Ruth. Well, what do you want to do? Do you want to do a sort of review on, do you want to go into my whereby? Shall I put that in the chat? Or do you want to ask them, can you?
I'm just going to stop recording just about.